17, 2026. Dr. Deukmedjian here. We're going to be performing the Deuk plasma rhizotomy. This is a type of rhizotomy to treat facet joint pain, in this case in the thoracic spine. Our patient has had spinal fusion done elsewhere. He presents now with pain in the base of his neck, in the facet joints. I'm going to go in and destroy the pain nerves in a process called rhizotomy. All right, shot. Very good. That's right where his pain is. Shot. We're going to go and destroy the pain nerves around T1 and T2. Yeah. Then we're going to go down to T7-T8 area where he has more facet pain. He's had a fusion done in the thoracic spine. How is the blood pressure? 120. Can we reduce that, please? I got it. So basically, the patient had a thoracic fusion done in Florida, not here. You'll see that later. He's had a cervical fusion. Now he has adjacent segment disease. On the x-ray, Jordan is pointing with the white arrow to the metal plate and the screws that are embedded in the bone. That's in the front of his spine. We're working on the back. He now has facet joint pain in the back of his spine around T1 and T2. Any questions from the audience?
At this moment, no current questions.
Let's show the audience how we treat facet joint pain in the thoracic spine. Wipey.
Facet joint injury is a common cause of chronic thoracic back pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. We're in the process of performing our Deuk plasma rhizotomy at T1 and T2 in a patient who travels here from Puerto Rico. Yeah, if you can help me get it down a little more. Shot. Any questions from our audience?
At this moment, no current questions.
All right. Well, we'll just proceed. We showed the video on how this procedure is done.
Correct.
Shot. 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 I think we're just about done on the T1 and T2 region. Pressure. Wow. Hernandez, we really got to do a little better job. Yeah. Well. All right, any questions for us?
At this moment, no current questions.
Just put pressure. Here. Okay. We've shown how thoracic facet joints can be damaged and cause pain, correct?
We have not. We have shown how it is that we cure facetogenic.
Yeah, always show how the pain is generated first and then how we cure it.
100%. Copy
Otherwise, it won't make sense.
that. Yes, 100%.
All right, let's go ahead and show them while we get ready to do our lower thoracic area.
No worries.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
One.
All right, welcome back. Our patient has thoracic facet pain. You can see his fusion that was done elsewhere. I won't mention where. And he left him with debilitating pain above his fusion. We're going to be treating the 7-8 region shot. It's bilateral. Yeah, right there. Now, he actually has more than one facet joint causing his pain. Wait, let me know. Is the IV working? Let me have some num-num. Yeah, I'm just going to wait a minute. Shot? Well, use balanced dilator. No, I wouldn't give him any more. We're just going to wait a minute. Keep pressure. We'll take some questions, but you've shown the video on how the facet joint can be painful.
Yes.
You've shown the video on how we treat it with our Deuk plasma rhizotomy, a patented treatment.
Correct.
We have no questions from the audience.
Correct.
Well, in that case, let's share with the audience the 30 causes of back pain. Now, the thoracic region is not really the back. It's kind of the mid-back. But that said, it does have many of the causes that we commonly see causing lower back pain, like disc pain, facet pain, fracture pain. But there's obviously SI joints further down. Let's show the audience. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. All right, welcome back. Is that you, Anthony? Or is that Henry? Sean?
That was me, Henry.
All right. Thanks, Henry.
Of course.
Sean? We're done with this side. Let's go to the other. Any questions?
At this moment, no current questions.
Right. Do we have any viewers?
Yes, we do.
They're just shocked and awed.
Shocked and awed. Mesmerized.
All right, I like that. Good. Supple. All right. Last facets. 3 minutes, 5 minutes max. I had no doubt, Dr. Berndes, no doubt whatsoever. Go ahead. All right, folks, we're almost done. If you have any questions, ask now or forever hold your peace.
As of this moment, no current
Sure.
questions.
Thanks. Thanks, Henry. Sean? Sean? Perfect placement. Jordan? We're still streaming?
Yes, we are.
So one of the interesting things I'll say is that over the last couple of years, as I do these Deuk plasma rhizotomies, I've actually gotten pretty good at feeling the pain nerve being severed when I get to a pain nerve that's large and well developed. Shut. And I can actually feel the nerve itself cut. It just takes a lot of experience to do that. And I've had quite a bit lately. Do a lot of these procedures. All right. I think we've just got one or two more to go. Shot. About 1 minute. Well, I want to thank everybody for joining us. Shot. Our patient traveled again from Puerto Rico. And hopefully he goes home a happy man. That's what we aim for. Joy and happiness in our patients with our treatments here at Deuk Spine. We'll be back on Thursday. We have a special surgery for you Thursday, one of the most difficult in medicine. A revision cervical patient who had a cervical laminectomy done elsewhere, and now he has what's called chin on chest deformity, where his head is looking down at his feet, actually his ankles and the floor constantly. He cannot pick his head up. That's what happens when you have bad spine surgery, which is so common. Bad spine surgery, lots of bad spine surgeons, lots of bad spine surgery being done. They did not do a fusion like they should have, and his head and neck just sunk down. And now I have to fix him. After having a posterior laminectomy and chin on chest deformity with a fixed deformity, I have to do osteotomies and intraoperative reduction, open reduction, and then fixation, probably from C2 to T3. He's an older gentleman, but nobody should have to walk around every day looking at the floor. So we're going to give it our best, hopefully get good correction of deformity and stabilization. That's going to be a special case you guys can watch. For those of you who doubt that I do fusion surgery, you're going to see one of the most complex cases in the world. Thanks for joining us. We'll see you on Thursday. Good morning, I'm Dr. Deukmedjian. It's February 12th, 2025. I'm sitting here with one of my patients who underwent the thoracic Deuk laser disc repair for a herniated disc in his thoracic spine. You came to us with horrific pain in your spine, and you came from Georgia. You had your surgery done 12 hours ago, and here you are after surgery. How do you feel?
I feel great. No more tired legs, no more hurting ribs. I don't know how to feel right now. I've had a hurting back for 2 years, been very depressed, felt hopelessness.
Why did you feel hopeless? Because the other doctors couldn't help you?
Well, I didn't want to go the route they wanted to do. I didn't want no fusions or nothing like that. I was on the verge of giving up. I didn't basically want to live no more. And I told myself that I can't do this no more. And I did. I got online, just happened one day, type in back surgery on YouTube, and I seen Deuk Spine. So I started looking and watching, and I was like, I'm going this route. I'm glad I did.
You can actually see we did your surgery yesterday in the thoracic. It was not easy to get into the disc, but we eventually did. Fixed your T8-9 herniation. You could see the laser in there cleaning up the pieces of herniation that were causing all that pain. Now here you are. When did you realize the pain was gone?
Immediately after I woke up from surgery.
Yes. Right? And look at you, you're
Yeah.
smiling.
It was awesome. I mean, getting up this morning wasn't like it usually is. I got straight up, and the other times I basically had to crawl out of bed. Been a long road. My body don't know how to act right now.
Well, you got a lot of good living ahead of you now that your back's fixed. Anything you want to say to the rest of the world?
If you're having back problems and don't know which way to turn, I advise you to do your research, find Deuk Spine. Dr. Deuk will fix your back. I guarantee it.
Thank you so much, sir. Safe travels home.
Thank you.
All right.